Hello, I'm Steve Edwards, and I serve as President and CEO of Cox Health. Today I want to visit briefly about Amendment 2, which will be on the ballot August 4th. I want to describe what it is, how it's funded, and what we think the benefits might be. First, this is expansion of Medicaid in our state. Right now, the eligibility level for Medicaid is 21% of the poverty level. This will move that eligibility to 138%. So as a reference, for a family of three, if that family makes more than $4,479 a year or $86 a week, they make too much to qualify. This would allow that qualification up to 138% or $28,000 a year. Who pays for it? 90% of the funding is ongoing federal match funding. This is from the Affordable Care Act. Where does the money come from? It comes from the ACA taxes. Those taxes have been in place for many years now. Missouri residents, Missouri businesses already pay this tax, but because we've not expanded Medicaid, those dollars don't flow back to Missouri. In total, about $8 billion have been left on the table, Missouri taxpayers' dollars. So an important part of this initiative for me, as someone who considers himself a fiscal conservative, is that we make sure that Missouri money comes back home. What's the economic impact of this? So there are several studies on this, two that I think are most important to me. One is from Washington University in St. Louis, the home of more than 28 Nobel laureates in their time. They have indicated that it would be a net gain for the state, both in jobs and economic impact and in state budget. There's another independent group that the Missouri Foundation for Health worked with. They projected a $2.5 billion economic impact to the state, 16,000 jobs, and 79% of those jobs being outside of healthcare with an average income of $15 per hour. Who supports this? Surprisingly, to some people, the business community supports it, as been expressed by the St. Louis Chamber of Commerce, the Kansas City Chamber of Commerce, and the entire Missouri Chamber of Commerce group. It's impacted by business, it impacts healthcare, impacts individuals. Who's passed it? What states have passed it? 37 states have passed it. I believe it's a nonpartisan issue because 20 of those states are led by Democratic governors and 17 led by Republican governors. It also has other benefits, like in those states that have passed it, their insurance premiums are 7% lower than those states that haven't passed it because we think there's some cost shifting going on to subsidize these lower Medicaid eligibility requirements. So an important point I would like to make about federal matching funds is never in our history, to my memory, have we ever turned federal matching funds for highway money down. That's usually a 50% match. So this is a 90% match. During the pandemic with stimulus money, PPP money, our state did not turn down money. And so it's important to remember that this is about as a good investment as we can get. To get 90 cents on the dollar plus economic impact makes it a net gain for us. Another secondary impact to this is the effect on rural local economies. Often the largest provider in a rural economy of jobs is healthcare. And we've lost more than 10 hospitals in the past several years, rural hospitals that cause a city their future trajectory to go down. This money will help those hospitals perhaps much more than urban and city hospitals because of the difficulty providing care and the economics in a rural area. Every day in our hospitals and in our clinics, we see the most vulnerable in our community seeking care, and often without insurance, they seek it too late. And what could be a moderate or mild illness becomes an acute illness that requires expensive and sometimes medically challenging interventions for these people. This expansion of Medicaid isn't affecting those that don't work. It's most likely affecting those whose income is above that threshold, the working poor, the essential workers, the people that were working during the most difficult time of this pandemic, that were exposing themselves often to employers that couldn't afford to provide them insurance. And so as a society, as a community, it's important for me that we provide coverage for these people that are working and putting themselves in danger. And as a broader community, we realize that when people have to make the choice to go to work or stay home and they don't have insurance, too often they're forced to make that decision to go to work. And in a pandemic, that decision could cause a further spread of this disease.